Post-traumatic stress disorder is an illness unlike any found in a hospital. There is no pill or surgery to cure it. It affects the brain, something we know very little about its function. Given that, any treatment for PTSD would be an experiment. Since the disorder is so multifaceted and affects everyone differently, one specific course of treatment is not the cure for every person suffering. Because of the valuable role they play in keeping all of us safe, it is crucial that we push for an effective treatment plan for soldiers with PTSD, or in this case, many different techniques to at least try with the soldiers, to see if there is any improvement. In this speech, I will present different techniques that have been implemented, like using cutting-edge technology, treatments never used in this context before, and an overhaul of previous treatment approaches in the military itself. As I mentioned before, there is not one sure solution to the problem of PTSD in returning soldiers, so there is not one best answer in these given alternatives. These are suggestions that have shown to be successful and helpful, but one is not entirely better than the other, nor is any less effective. There is no way of knowing for sure what will work best in the long term, but it is safe to say that people recognize the problem and are searching consistently for a new treatment. A video created by the Science Channel in 2009 states that a British study found that conventional psychological treatments just cannot prevent the onset of the disorder. To combat this, new treatments have to be developed. Of these new treatments that seem to be working well is the use of virtual reality. The sufferer relays the traumatizing event to a psychologist who then recreates it virtually. The program is run as many as 15 times, if not more, with the hope that seeing the event repeated will alleviate some of the anxiety from it. The program uses sights, sounds, vibrations, and even smells to trigger the memory. The psychologist talks through the event with the sufferer each time. Some think the treatment is opposite of helpful, as it forces the soldiers to relive the traumatizing experience over and over, but the experiment has proven to work. Many claim that since modern generations, the ones fighting in Iraq and Afghanistan now, have grown up on video games, it will be easier for them to accept this form of treatment, as opposed to sitting and talking with a stranger about their traumatic experience. The same Science Channel video follows one young man diagnosed with PTSD who tried therapy and medications that did not work before finding this treatment. He admits to not being cured entirely, but the small steps he has taken in the 6 months since he began the program have given him his life back. Similarly groundbreaking, a doctor from Columbus is researching tapas acupressure technique as a way of helping soldiers suffering from PTSD and their families. Harold McRae has worked with soldiers for the past 35 years and is trying this technique that was created in 1993. As stated in an article in the Columbus Leader-Inquirer newspaper written in 2008 by Lily Gordon, it is supposed to help patients let go of the past and eradicate fears and phobias by restructuring neural pathways that have been damaged by stress. Tapas acupressure technique involves activating pressure points near the eyes and the head while concentrating on a series of statements related to PTSD, like, "I'm not safe." The technique has proven helpful by patients that have tried it. The technique has not been federally approved, so it cannot be officially implemented by the Army, but with doctors like Harold McRae working in close proximity to Army bases like Fort Benning, those soldiers seeking alternative PTSD treatments now have an option available to them close to home. In 2008, Barack Obama elected Aaron Shinseki as the new Secretary of Veterans Affairs. In 2003, Shinseki was removed from his position as Army Chief of Staff when he contradicted the Bush administration, informing them that they were grossly underestimating the number of troops needed to invade Iraq. Shinseki took the initiative in a 2010 public address to remind veterans that the VA is using and getting new cutting-edge treatment programs for PTSD, as well as employing more than 20,000 mental health professionals. He emphasized the need for early intervention to prevent post-traumatic stress from developing into post-traumatic stress disorder. The VA can help with coping skills and mental health care to avert the more serious condition. According to Shinseki, veterans coming to the VA for the first time are screened for PTSD, depression, and alcohol misuse, as well as symptoms of traumatic brain injury. Should the veteran screen positive for any of these conditions, the VA provides further evaluation and appropriate treatment. I'll remind you now that the VA does not only assist soldiers returning from Iraq and Afghanistan, but any soldier from any American war that is suffering from post-traumatic stress disorder. This overhaul of the VA is proving essential in diagnosing and offering treatment to soldiers with PTSD. Whether it's using video games from our childhood, trying new innovative techniques, or even restructuring an entire government agency, it is clear to see that people are putting forth effort, time, and money to find a solution, or maybe just assistance for soldiers suffering from post-traumatic stress disorder as a result of combat in Iraq and Afghanistan. In our society, these men and women are invaluable, and everything we can do to help them should be done.